Hi, my name's Ashley Goodman. I'm coming to talk to you, the school board, today in Duluth, Minnesota, about some problems that I've learned in recent studies. My name's Ashley Goodman, and I'm a health education professor at the University of Minnesota, Duluth. I'm concerned with the growing epidemic of eating disorders that Duluth elementary schools have come across in the past year. Kids who are young as third grade are being affected by this eating disorder. This means kids that are third and fourth grade are all being taught things that are very, very misunderstood about their nutrition, their diet. There is an alarm that I need to send out to this community about what is going on and what needs to be changed, and I would like to introduce some issues today. I've been professionally investigating some research studies around the United States on what they are doing, what schools are doing to send out prevention methods for eating disorders, and what they're teaching our students. I found that a lot of the prevention methods are being instilled, however, they're really lacking on the self-esteem topic. A big thing that I want to talk to you about today is what is missing and how we aim to fix it, and how we should fix it too. I talked to a woman who I've discussed with her about the positive attempts that people are trying to make. She is a college student, and she has been affected by eating disorders throughout her life. Her name is Megan, and when asked about presenting this idea about instilling prevention methods to to elementary students, she said it's never too early to get the word out there and teach nutrition information. It's very relevant now that the media depicts our body image as a self-worth. And I think people should really learn how to eat well and take care of their bodies, Megan said. So what I intend to do is benefits of eating disorders need to be accurately measured. And how we do this, no expert has been depicted to show. However, we can help our future students be realistic and be taught the harmful facts about what they are causing themselves by eating disorders, by having eating disorders. So if students can obtain just certain knowledgeable facts about them, they can pass them on to fellow classmates and fellow students, and they can really reap the benefits of this prevention method. In the past year, I found 25 elementary students in the Duluth Grant Nettleton Elementary School that have been affected and show previous continual eating disorder signs. And I have three proposals I'd like to offer you guys so you could help on and send them into our community. First thing I want to tell you is that there are people that are willing to help. I've talked to many college professors, I've talked to many researchers, and they've stated that there's a rapid increase of eating disorders from puberty to adolescence and all the way until the age 25. So this means most teenagers and college-age students are mostly being affected by this disorder full-blown. And what I think is most beneficial is if health education majors are instructing other students how to benefit themselves and help them so they do not harm their body. And what I think should be done is instilling knowledgeable information about eating disorders out into the public, especially into our youth. And this hopefully will be a fix for the future. Why I feel like we should involve UMD, University of Minnesota Duluth health education students. What UMD health education students do is they are required to meet 9 to 15 hours or 9 to 15 credits of internship. This means for every 40 hours they get 1 credit. And by presenting this challenge for the health education students, they get to receive a hands-on experience in the classroom. By teaching this in the classroom, the students can prevent future elementary students and future college students from taking the next step in obtaining an eating disorder. This not only benefits our school systems, the high schoolers, the college students, and the elementary school students, but also our entire community, which is really the overall picture. So my 3 proposals. My first proposal. I want to involve classroom information. And what this focuses on is understanding the disease and the effects that are really focused on eating disorders. What students may not realize is that eating disorders are psychological illnesses with serious medical consequences. So what I want to do is I want to have monthly in-depth presentations on health risks from acquiring the disease through the aid of PowerPoints. So I want to have another additional aid with monthly presentations on nutritional facts and how the body needs fuel to keep it running properly, also through the aid of PowerPoints. So I want college students to be able to go in the classroom, give 2 different presentations monthly, and be able to really discuss and to show the real facts, the hard issues into the elementary students about why they shouldn't take up this disease and how to eat nutritionally and the benefits that they can really reap instead of the negative consequences they can obtain. My second proposal is one-on-one help. My focus for this is opening up communication support. Eating disorders stem from an inability to deal with uncomfortable situations and feelings. So what I want UMD students to do is pair up with 1 to 2 children, depending on the class size, and have weekly meetings with each student. A kind of a mentoring type thing. I really want the elementary students to show different feelings, emotions, and release pressures that they may not have been able to discuss or feel comfortable enough to previously talk to about with parents, teachers, or their peers. With this proposal, they'll be able to create posters and flyers to show support and knowledge that they will gain throughout the entire process. So the third proposal I now have is focused on teaching elementary students to make healthy and nutritious meals. This is my after-school parent-child program. And eating habits of children from birth to 16 years old show a direct correlation between the parents and the meals they provide. So what I want is an after-school program that will be set up to have weekly kitchen themes for parent interaction, which is really strongly encouraged with the students. The students in this interaction, in this after-school program, will be taught how to make meals, not only for themselves, but they will be quick and easy, and they will also be extremely healthy. So the students won't have to worry about, is this healthy enough for me to eat? Is this going to make me overweight? Because a lot of students are really facing that these days. And hopefully with the parents coming and helping their students learn how to cook and make easy meals and nutritious meals, it'll really form a bond between the parent and child. A lot of my proposals are very geared towards parent interaction, peer interaction, and all of them have UMD students interacting with them. Proposal 1, which is classroom involvement, there's really very minimal fees that are involved in this. The main fee will probably be fitting the budget in to have students come in. The main thing is trying to coordinate time for the students to come in to give these presentations, where it might be a little tough to see where they can fit in because of teacher times, classroom adjustment, room adjustment, and getting feedback from the teachers to make sure it's clearly working with their students. For proposal 2, the one-on-one help, the biggest budget will be a little bit of an increase. It's not the biggest, but it's a little bit of an increase because of the crafts, when they'll be making the posters and the flyers to show and document all the work they've done and they've learned throughout this presentation with their mentors and their big buddies type thing throughout the course of the semester. The third program, which is the after-school parent-child education program, where they're preparing food. The biggest thing in this will be trying to figure out recipes for the students that are low budget, providing food for the classroom setting, so then the students can get food so they can actually work hands-on during this theme, and hopefully having the parents come will be the highest budget, because we want to really send out flyers and notifications to the parents, getting them really involved in what's going to be happening. This will be the most time-consuming activity because it'll be after school, it'll be on people's own time, and it'll be on the help of all of our aides' time. Each one of these activities, proposals, will not have to pay any of its volunteers, because since UMD students have to do this for credits and their volunteer internship, we won't have to worry about any payments for them. So as you can recall, I have 3 different things. Proposal 1, classroom involvement. Proposal 2, one-on-one help. And Proposal 3, an after-school parent-child program. So what I want you to do as a school board, as a school member, you are in a unique position to craft, implement, and fund policies that encourage administrators and educators to improve the quality and delivery of instruction. Please understand that without the tools to properly arm ourselves against the heavy critics of society, we might never see a change in our school, especially since it's pretty relevant right now. I just want to thank you for taking the time to hear my proposal. I hope I am able to convey the importance of why our elementary students in Duluth need to be educated on positive eating habits early in life. Positive prevention methods from the eating disorder epidemic might cause a halt in the rising numbers, at the very least exhibit a decrease in the number of instances we have found. I'm eagerly awaiting your response, so if you would like to take some time and respond back to me as soon as you get a chance. I know the next school board meeting isn't for another month, and I hope to hear from you then. If you don't want to pick just one, all 3 would be amazing, but I know due to our budgets and the economy, one would probably be the most beneficial right now, suited for our funds. So if you could just respond back to me, that would be great. Thank you.